Hello, this is Andrew Kohlmeyer at Andrew Kohlmeyer Massage, and today I would like to talk about balance issues in the legs. So, a thing that happens up in the hip is people have hip pain, but it also they don't realize that it steals the power out of the front of their leg. So that would be like their ability to march or like to put their leg into a vehicle. You'd have to like lift up the leg to put it in a car. So yeah, that can affect your balance because your leg is not efficient anymore, and you're going to use the muscles that aren't the prime movers of your hip flexion and your knee flexion. So you want to understand that when you have this inguinal ligament right here that crosses this femoral nerve, that you'll have soft tissue mineralization right there at this point. So what you want to do is you want to get in there, make your fingers kind of like that, and get in there and crush that stuff up. As soon as you get that stuff out, the power just comes right back to that femoral nerve. Normally, like always, I've never really had it like where someone was like, "Oh, I still have problems." It's usually it just comes right back, and they can really feel it. So, and also the pain reduction is far less. So yeah, that gives you the power back to your leg, so you can actually operate the lower portion of your leg. So we'll slide down here. And for the lower leg, this is where all your balance coordination is located in your leg, between your tibia and your fibula. So when you trip over something, this is what saves you from wiping out. And you don't want to have the tightness in there, so you have to get between the bones and kind of like, you just grip and you do like a chucking kind of motion. You're just trying to get more space between the bones, so those muscles that control your balance are going to work. They're going to operate quickly. You have to just snap of a finger, correct your balance when you trip over something, and just your regular gait will be affected. So there can be mineralization in there, and that is usually from your tendon sheaths that come down here and form the muscles in your foot. So you want to get down here on these tendon sheaths. They're basically like a connective tissue pipe organ. If you took everything out, your muscles have to run down through that. So when they're all full of mineralization, they can't slide efficiently through those tendon sheaths. So you need to break that stuff up. So you just, deep friction over those connective tissue tubes. You'll feel them, they'll feel crunchy. And that's the snap, crackle, pop when you get up in the morning. It's just those muscles trying to slide up inside those tubes to get their territory back. So again, you got to have a reasonable amount of, less density between the tibia and the fibula here, or you're just not going to have any balance. It's just, it's going to be really a struggle to walk efficiently without being a fall risk. And that's pretty much it for the major stuff for your balance. It seems like it's it could be such a complicated thing when you're experiencing that, but it's really not. Watching the hip stuff up here is really important. You got to have this okay to power the stuff down into the lower leg, effectively. And that's about it, for most of it. The major stuff that's going to give you. There's some other issues with, let's see here, the knee. You have the pes anserine, which is in here, and you'll have mineralization in there. And your three big muscles that come off of that, you have sartorius, gracilis, and semitendinous. So if you're having like the stick up the leg, back of the leg kind of feeling, or you're having like bladder urgency coming from this gracilis, or hip pain here from sartorius coming up into this area again, right about there, you want to make sure you're just hitting it in the same manner, deep friction with little glide on the skin surface. And right here, it's Pezan Serene. You just make your hand like a little hook there and pull up and break that mineralization up. And that's pretty much it. You know, you can really achieve a lot more mobility and, you know, confidence in your walking ability having these issues resolved. All right, I hope this helps some people out. All right, take care. Bye.